Unit 5 is a fun unit to discuss as we get into consciousness and unconsciousness. We're going to be talking a lot about sleep and the sleep patterns and what happens when we don't get enough sleep and some of the sleep disorders. And then your favorite, the drug part. The one thing, though, is this is a unit that doesn't have a whole lot of weight in the AP exam, but we will spend a good time talking about Unit 5 because there is so much interesting stuff in it. So, has anyone ever been put under due to dental procedures? That can be very similar to being on a psychoactive drug. If you want to watch a really funny video, there's all kind of videos out there like this, but David After the Dentist is a good one. I always have fun with watching that shows a boy who just had a dental procedure done and was having after effects and a good discussion with his father afterwards. The next one is when and why do we have weird dreams? The dreams that we have. Wouldn't it be interesting to understand really what our dreams mean? We will spend some time on dream analysis one day. All right, so consciousness, as we talked about before, is part of the dual processing that goes on in our two-track mind, which we talked about when we talked about our brain. If you guys remember what the unconscious is, it automatically occurs under our unawareness. And that's how we process as well. There's two major figures in psychology that we look to when we talk about consciousness research, and that is William James and Sigmund Freud. William James talks about the stream of consciousness that is almost like an episode of one moment flowing into the next. Sigmund Freud spends a lot of time on the unconscious, as we're aware of, this hiding place for most of our anxiety-provoking ideas, our emotions. They're uncovered and hidden. That could lead to our healing, as well as it leads to what Freud says is a lot of our behavior. All right, so Freud viewed the unconscious as a repository of our childhood experiences that influence behavior without our consciously knowledge. Okay, and so we're going to spend a little bit of time into that. So, what is consciousness, and what are some of the aspects of it? All right. A conscious awareness is part of that dual process which we talked about. There's what we call the near exposure effect. This is a term that you may see pop up on a test. It's where we prefer stimuli that has been seen before over novel stimuli, even if our consciously remember seeing it before. So don't be surprised if you see that pop up as one of the terms on a test, the mere exposure effect. All right, so there are levels of consciousness that we need to understand. There is consciousness, which is our awareness that we talked about. There's what we call the non-conscious, and this is part of the autonomic nervous system. This is what our bodies controlled are, all those things that occur without us even thinking about it. There's what we call the pre-conscious. The pre-conscious is things that we're not thinking of. It is our memory. But what is interesting is it can be recalled to memory through memory cues. So it's just kind of sitting there waiting for us to be pulled back in. There is the subconscious. This is that we are consciously not aware of. And then there is the unconscious, the unacceptable and conscious mind that we repress. And we're going to spend a little bit more time on that. So one of the concepts that we're going to talk about in this unit is called hypnosis. This involves an interaction with one person, what is known as the hypnotist, who suggests to another, which is the subject, certain perceptions, feelings, or thoughts or behaviors that will spontaneously occur. Is it really an altered state of consciousness? So anything that doesn't involve our consciousness, if so you understand, is what we call an altered state of consciousness. So in this next slide, you will see some of the altered states of consciousness, from daydreaming, drowsiness to dreaming. So we're going to talk about ADHD later, but that's involved a lot there with the daydreaming. Some physiological induced, you got hallucinations, orgasms, and food and oxygen starvation, and some psychological sensory deprivation. That is when we're depriving our senses from things. Hypnosis and meditation, and we'll spend some time on meditation and relaxation during this unit as well. What is interesting as we get into hypnosis is the power is not in the hypnotist. The individual or the subject has to be open to those suggestions. Okay. So if you're not willing to be hypnotized, you're not going to be put in that altered state. You're going to control that. If you are willing to be hypnotized, then that power lies within you, and you are giving it, if you will, to the hypnotist. Just like an altered state of consciousness is psychoactive drugs, you control that. If you give that control up to the drug, you take the drug, and then you become altered. So some frequently asked questions about hypnosis in this slide. All right, so what is the process like in being hypnotized? A suggestion is made during a hypnosis session and is to be carried out when the subject is no longer hypnotized. Some clinicians use this to help undesirable symptoms or behaviors. What is the most common one you think people go to a hypnotist for? It is to overcome things like smoking or other kind of anxieties that you may have. So what happens is you go through what is called a post-hypnotic suggestion that helps alleviate headaches, asthma, stress-related anxiety, or skin disorders. Hypnotherapists help patients harness their own healing power. They claim that 70% of people have a greater improvement than other patients through hypnosis. So can I be forced to act against my will? We are all open to suggestion. This is called susceptibility, the ability to focus attention totally on a task and to be absorbed. Is it allowed in court, for example? Many courts ban hypnosis. Reason is you are not necessarily sure if the hypnotist is placing that memory in your brain through the process or not. One of the things that came about last couple of years, if you guys paid attention anything to the Brett Kavanaugh hearing for the Supreme Court, the woman who claimed that he had sexually molested her and everything testified of this she found out about this through hypnosis. And because the courts do not allow that as a testimony, it was not allowed. She couldn't recall it other than through her hypnotist. This is probably one of the most commonly viewed thoughts about what psychology is where patients lying in a comfortable couch, in this case, a chair with an ottoman, in which a psychologist is treating the individual. So what kind of things have we seen through hypnosis? Here are some slides that talk about dealing with addictions, as I mentioned before, responding well for people who are obese, helping them with their eating disorders, etc. So what happens in hypnosis is it induces a patient to be what is known as a good subject. creating a state of dissociation. Dissociation is a separation from oneself. And this is part of what we call a due processing, where we selectively attend to maybe an injury or a competition where we feel no pain and overcome that. So an extension of normal consciousness social influence theory of hypnosis explains that people can begin to feel and behave in ways that are appropriate, what we call a good hypnotic suggestion or subject, as I mentioned before. Hypnosis is an altered state. Like I said, this is a dissociation, a split between different levels of consciousness. This is what we call the mind split, the ability to handle two tasks, what we call commonly multitasking. For example, doodling while listening to a lecture is an example of a mind split. Many of you probably have done that in your classes. I know not mine, but other classes. Let's again talk a little bit about the theories of hypnosis. This is a slide that shows you through a chart that our attention is diverted from a painful ice bath. How? The social influences is that we're caught up in the hypnotized role, and so she ignores the cold. Also, you have the divided consciousness theory, which hypnosis is cause a split of awareness. This is what happens in dissociation. I don't know if you've ever had an ice bath. It is quite the experience. The biopsychosocial approach explains hypnosis through this slide. You can analyze this a little bit. I won't go into great detail about it, but this will help you understand all those aspects put together. That will conclude Mod 22, and we'll talk more about this when we get back into class.